into the dimension of stress to all of our lives. As healthcare workers, many of us are feeling the weight of all of this change, uncertainty, and risk. Our own anxiety and fear and worry may make it difficult to focus on looking after our own needs. However, as an increasing number of people look to us to provide care and support, it becomes more important than ever to make time to look after ourselves so that we have the energy reserved to care for and support those who are most vulnerable in our society, including those with physical and mental health needs. I've invited my friend and colleague Tessa to help outline some self-care ideas to help us all cope.
Hi, I'm Tessa Koltoff. I'm a psychological associate at Women's College Hospital, and I'm going to talk about 10 ideas to cope with COVID-19. This is a time of stress and anxiety for many, so it's important to remind ourselves that we are humans and that these emotions are normal. We can't always disconnect from these feelings of fear, and so we have to be gentle with ourselves and remind ourselves to just focus on the things that we do control. To manage your stress, take time to unwind. Try to do some activities you enjoy, such as reading a book, watching TV, doing yoga, play with your kids, play video games, or walk the dog. When you focus on danger, your anxiety grows. But when you distract yourself and turn your attention elsewhere, it tends to shrink. So finding distractions throughout the day can really help lower your stress levels.
Other ideas include attending to the basics like deep breathing, meditating, healthy eating and exercise, journaling, and doing creative projects. I also like really using visualizations. So sometimes instead of focusing on where you actually are, it can be helpful to picture and imagine in your mind where you want to be. Sleep is going to be really important, but for some people, much more difficult during times of stress. Some things to keep in mind are setting a sleep schedule, cutting down on caffeine, and putting your phone away at night before you go to bed.
You may feel isolated, working by yourself from home, looking after your kids, or taking care of family members who are in need of care. It's important that we stay connected in this time. You can use your phone, text, email, or other online resources to stay in touch. Don't be afraid to reach out and ask for help. It can be supportive to let other people know how you feel, or to get a different perspective from family, friends, or colleagues. You might also want to connect with existing or new professional supports, including mental health practitioners. Fear and anxiety can be fueled by misinformation. Try to stick to the facts from valued and trusted sources of information. Hearing about the pandemic repeatedly can be stressful. It's a good idea to take breaks from watching, reading, or listening to news stories, including social media.